Hey everyone, should we get started? I think we're just about 5 minutes over, so we want to make sure we have the full hour. I'm just going to do a little sound check because we have people joining us online. So Bree, maybe you can, or somebody can give me a little wave just to make sure. Deanna, do you? Oh, she just stepped out. Okay. We have people online. Okay, great. Well, welcome to those of you who have joined us today online. And thank you for attending this session. So I'll just start by saying hello and hadi. Today, this session is celebrating a very special partnership between UNBC, the Northern Health Authority, and PHSA, or the Provincial Health Services Authority. It's a partnership that has promoted collaboration for health research in Northern BC for the past 10 years. And so today we have an agenda. I'll just go through how we see the session going. Can you just advance for me? Oh, okay, so we're going to start the session today with a welcome from Elder Darlene McIntosh. I'll introduce her in just a moment. We're then, I'll give a brief overview of the partnership and really how it started actually and where we see it going for the future. We then have invited 5 speakers today who were recipients of awards from the partnership, who are going to tell us about research projects, their partnerships, and some of the outcomes of that research. And then we'll have a panel discussion with those presenters where we can just ask them a few more questions, or the audience can engage with questions that you've had perhaps from their 5-minute presentation. So before we get started, I want to invite Elder Darlene McIntosh to the podium. She is the Chancellor of UNBC, and she is going to provide a welcome to us to the Lithuania lands on which we are gathered here today. Adi. Adi.
Thank you. So the first thing I want you to do is take a nice deep cleansing breath throughout your whole body. Nice deep cleansing breath. So the first day you were born, you took your first breath and you never stopped breathing for 70, 80, 90 years. And what do you call that? You call it a miracle. Each and every one of you here is a miracle. And we know when we come to this earth plane, we come to be in service and we come to have a purpose. And that's obvious to me that you all have that purpose, and that's so wonderful. As we breathe into our body, just think of yourself outside on this beautiful day. We have an El Nino happening. It's warm. I just talked to another lady from Fort St. John, and they've got like a foot of snow. So consider yourself lucky until it starts snowing. But we welcome the snow because Mother Earth needs the snow and the water and everything that goes with it. We are in climate change and so unpredictable. So each of you can contribute to a positive energy when we talk about Mother Earth, because Mother Earth sustains our life here on this beautiful earth plane. And how do each of us help make the earth healthy again? You know, we've got so many people on this earth plane, and there is no reason why we can't come together and make it better for all. As we breathe into our body, we pull that breath all the way down into our feet. And just imagine yourself outside and you feel the beautiful soil under your feet. You can see the greenery already. And you connect with Mother Earth. She grounds you into a good place. She grounds you and she brings you together. We become one here. We create a sacred energy for us to do our work in a good way. So we, the Lheidli Nation, have been on our traditional lands over 9,000 years, as supported by lithic evidence. And the changes that have taken place over thousands of years supports the enduring strength, courage, and fortitude of our peoples. And something that we need to think about now is that we're coming into Remembrance Day. And we think about our Aboriginal veterans and what happened to them when they came home. They were disenfranchised and they were no longer accepted on their reserves. They were deemed heroes in Europe, and they came home and they were deemed second-class citizens. And that's not just with our Aboriginal veterans, it's also for all the men and women that fought for our country. And we wouldn't have the peace and the joy and the freedom that we have now. And so we really need to think about that and be in gratitude and be present when November 11th comes. You know, the war has been passed for a long time, but as we see now in the Gaza Strip, it continues. And it's so sad because who suffers but our civilians, not the people who make the decisions and want war. And like, this has to stop. So our governance through the Abatlas brought balance and harmony with our brothers and sisters of other First Nations people. Lheidli T'enneh's clans are Frog, Wasilu, Grouse, Sutsut, Beaver, Sa, and Bear Sus. And through this system, we know who our family connections are. Through our oral history, the use of legends told of our travels, our hunting and fishing territories, our trading practices with all peoples. We remember and hold steadfast in what Creator's blessed us with, and that is our traditional territories. 4.3 million hectares of traditional territories that we are the protectors of. And also you, anybody who comes to this country needs to acknowledge that they're part and parcel of protecting Mother Earth. So our ancestors will always welcome people to our territories on behalf of Lheidli T'enneh's elders, our youth, community members, and chief and council. It is absolutely my honor to welcome each and every one of you to our traditional territories. All my relations must see, thank you. Please be seated.
Thank you so much, Elder McIntosh. I had the privilege of starting my day today at a workshop run by Sarah DeLeo on anti-Indigenous racism in the healthcare system. It was an incredibly powerful and emotional workshop. And so I always appreciate the welcome that you give, but today it feels particularly gracious. So thank you so much. I just wanted to start by introducing myself and who I'm representing here today. My name is Sarah Gray, and I'm the co-lead of the HRI, and I will also introduce my fellow co-lead, Margot Parks. We, for about a year and a half now, have been the co-leads of the HRI, which stands for the Health Research Institute. So the Health Research Institute is a UNBC research institute that strives to promote collaboration amongst health researchers who are engaging health research for the North. We also try to facilitate events that promote convening of health researchers here in the North. And we also represent UNBC on many provincial committees where we're talking about the health research climate in the province and how academia fits into that. And so today we're here to celebrate one of the initiatives that has been held within the HRI well before Margot and I started as the co-lead. It was actually initiated by Martha McLeod, who's here today in the audience with us. And it really is a celebration for us. This is an incredibly important partnership that has really been one of those tangible examples of how initiatives led by the HRI in collaboration with partners has tried to promote and drive new research. So I'll just move on to the next slide. So I wanted to just give you an overview of the partnership, which we've said here has been in existence for the last 10 years. So actually the first research grants were given out in 2015, but there was a lot of behind the scenes work happening before those first grants went through the door. So the partnership, as I've mentioned previously, is with UNBC, with the Northern Health Authority, and with the PHSA, or the Provincial Health Services. And there were these three principles that were set out in that partnership 10 years ago. It was to enhance research collaboration, to attend to the needs and realities of Northern. It was to build capacity in the North for the North, and it was to improve the quality of health services and population. And so these principles were pulled together for this particular partnership, but represent mandates and principles of the three organizations together. Next slide, please. So this slide just details some of the intricacies of that seed grant program, but I just actually Martha just was able to reinforce for me who was really behind the development of this partnership. And it was really the leadership of Martha McLeod and our president now, Jeff Payne, who was the co-lead of the HRI in 2012 when it was started. And then our previous Northern Health CEO, Kathy Ulrich, who Martha described for me. They put a proposal together to have some actual research funding that could actually propel some of these partnerships and new together that follow these three. And so we thank you for that work. And that led to this initial seed grant program, which was a total of $260,000 worth of grant funding that went out to researchers from these three different organizations. So between 2015 and 2023, 26 projects were funded. That, again, the principles of that funding program was that you must have collaborators from all three organizations. And the majority of those projects, if not all of them, also involved community members within their research. In addition, projects needed to be new, representing new partnerships and new projects. And again, they were to focus on the needs and the realities of health in Northern. So today we're very fortunate to be joined by 5 representatives from 5 of those 26 projects. And we're going to hear from them. They're going to each give a 5-minute presentation of their project, and then we'll go into. But before we do that, I would just like to acknowledge some of the key people from the 3 organizations involved in that initial partnership. I'm going to first acknowledge the people that are still involved in the partnership. I'm just going to acknowledge sort of the past players. So currently, I just want to thank Ellen Chesney and Dawn MacArthur. They unfortunately weren't able to be here today, but they have really been trident supporters of this. They meet with us quite frequently to talk about the progress they've helped to implement the granting process. Dawn MacArthur, I think, is on the path. And anyway, they've just given a huge amount of support and continue to give us support to this. I'd also like to thank Fraser Bell and Julia Bickford, who are really the key representatives from Northern Health which have maintained and really advocated for continued work. And at UNBC, I just want to acknowledge the Vice President of Research. Most recently, that's been in collaboration with Kathy Lewis, and coming on board recently is Paula Wood Adams, who is very supportive of the program. And of course, to Liana Garway and Bree, who do a lot of the administration for the granting program, and then the past and present members or leaders of the. And so before we go ahead and our speakers come, we just want to give special thank you to Martha Cloud, not only for your initiation of this particular initiative, but for all of the advocacy done for health research in North. And if it's not too much to ask, we'd like you to come up and just have a little gift in thanks of all the partners. You want to come? Thank you so much. Okay, so without further ado, I'd like to move on to talk about the research. So the first speaker that I will introduce to you is Dr. Esther Alonso. She is the Regional Lead for Ethics Services and Chair of the Northern Health Research Ethics Board. She will introduce her team that was involved in the research to you, but I will just let you know that she will be speaking about developing a moral empowerment program to address moral determinants of providers' well-being and contribute to healthcare efficiency and sustainability.
So good afternoon, everyone. Thank you very much for inviting me to this event. Thank you very much for that introduction. Thank you very much for that welcoming. I really felt seen, and that means a lot. So I'm here today to talk to all of you about the Northern Health Moral Empowerment Program. The first thing I want to say is actually I'm going to be moving around because it feels more comfortable that way. So first of all, I want to thank all my collaborators. Without them, without their passion, their commitment, and their expertise, this work wouldn't be possible. I want to mention all of them. Dr. Banner Lucari is here with us today, Dr. Virani, Dr. Clark, Petra Panagos, Viva Swanson, Jessica Fee, Amy Blantin, and Vanessa Mueller-Prevost. As I said, their commitment to this program has been beyond words. The next slide, please. The second thing I want to say is that burnout in healthcare currently is real. I don't have to tell you that. I don't have to convince you of that. I hope so. Healthcare workers are reporting unprecedented levels of burnout. And we all know that burnout impacts their well-being, their psychological and physical well-being, which in turn impacts the care that patients are receiving, which in turn impacts then the organization. We are now challenged by staffing issues, early retirements, resignations, poor outcomes. A very recent study has estimated that in the next few years, the healthcare system in Canada is going to lose around $213 million just because of burnout. Therefore, I hope that that convinces you very, very deeply that it is imperative to address burnout root causes. The next slide, please. And there is a well-established body of literature saying that one of the root causes of burnout is actually moral distress. It's that feeling of discomfort that healthcare providers experience when they are not able to do the right thing, either because they are experiencing barriers to do that, what they consider to be the right thing, or because they don't know what the ethical course of action is. That is moral distress. That is one of the root causes of burnout. The next slide, please. But then we were wrestling with this question: does it need to be a negative experience? Do we need to think of moral distress about something so negative? The next slide, please. This is exactly the premise behind Northern Health Moral Empowerment Program. If we provide the right tools, if we equip our healthcare professionals with the necessary culture, organizational culture, with the necessary ways to think about moral distress and ethical challenges, then that negative experience can actually be transformed into an opportunity to identify gaps in care and to address those gaps in care. But to do that, we need to structure very effective interventions that go from the bedside to the boardroom. We need to change the organizational culture. The next slide, please. And that is the Moral Empowerment Program. We are trying to go from distress to empowerment. We are trying to equip teams with the tools to think ethically, to address issues, and with the motivation and courage to address those issues. This is an 8-month curriculum that builds on ethics theory and adult education theory, integrates conceptual knowledge that is coming from that theory, but also grounds that knowledge in the everyday practice of bedside staff. It's grounded on personal inquiry and reflection. You will hear me saying this a lot. Ethics is personal. Moral distress is personal experience. So this needs to be grounded in that personal inquiry and reflection. And it's going to be organization-wide. As I said earlier, if we don't change the culture, if the culture is not receptive to those providers who are going to be empowered now to address moral distress, then there is nothing for us to do. We are doomed. So we need to start changing that culture as well. The next slide, please. And the last thing I'm going to say, last but not least, certainly, is that this work wouldn't have been possible either without this seed grant program. That seed grant program actually gave us the opportunity to finalize the members of the team that are actually building that curriculum now. So that was that last impulse that we needed to make our team stronger. So for that, thank you very much as well.
Thank you. And we're going to just move right to the presentations, and then we'll have an opportunity for discussion following those. So I'm next going to introduce Dr. Davina Banner-Lucaris, who is a professor in the School of Nursing at the University of Northern British Columbia, and she'll be speaking to us about building dialogue for clinical research collaborations and leadership in Northern BC.
Thank you so much for the invitation to be here. I want to first acknowledge this, we're gathering on Gately territory, but this work took place across the north, and just wanting to recognise the many Indigenous communities in the north in which this work took place. And then also to start with how amazing these funding competitions are, because they really give rise to opportunities for collaboration that in turn can bring innovative and transformative research. And so this was a study that came really from the ground. It came from the north and a desire to build clinical research capacity. And we can see here our partners. And so I've partnered with the fabulous Julia over here. And Rob Olson, but also another co-lead was Barbara Kroom, who is our community partner, and as well as our postdoc fellow, Nassim, as well as many others that you can see. So clinical research capacity, why is it even important? Well, innovative clinical research saves lives. It gives rise to many innovations. In fact, much of what we see in healthcare today has come about because of clinical research and health research. And it's really important in advancing the health and well-being of populations. However, rural and northern communities are often excluded, and that's for many reasons. A lack of capacity, a lack of resources, but also often geographical distance from the larger centres where clinical research tends to be supported. However, COVID-19 really shifted the tables, and it changed a lot in clinical research. It changed how clinical trials were managed, and it actually gave rise to opportunities that as rural and northern communities we can capitalise on. And so this was all taking place at a time when Northern Health and the North was also looking at ways to bring clinical research to the forefront. And so really we came together with the desire to build more equitable access to clinical research. And there was a real appetite for this. And so we partnered with Northern Health as well as BC Cancer and here the team at UNBC. And actually it was just such a great experience. Thank you. Actually, sorry, could we go back one? I just wanted to draw attention to the top diagram there, because we did go through quite a few stages as part of this work. And again, these seed grant competitions really allow for a lot of flexibility in how you work. And so not only were we able to scope the literature, we undertook some interviews and we did a priority setting workshop. And we're now really moving into, we've co-created an action report, and we're now really in the thick of the knowledge mobilization. And so we will have, we've got an action report that's been published and distributed, as well as a manuscript that's currently underway. Sorry. So what we heard? Well, we heard for a need to redefine clinical research in a way that's meaningful for the North. We also heard that there was a real emergence of a new culture, a new desire to really explore clinical research and what that could look like. And so we saw a new point of departure and a new culture, as well as shifting mandates that are giving rise to new opportunities. So really it was kind of a trifecta of opportunity. We also heard that while we're interested and we're invested, people were like, well, where are the resources? And that was a key thing that came up time and time again, not only in terms of equipment and space, but also in the ability to attract and retain people that are skilled in clinical research and clinical trials, as well as more informal and formal research training. So how do we grow our own? And so there was a real appetite to look at the great talent we already have here. And then the need for geographical proximity became really challenged. And so, as I said, in COVID, we saw a big transition in how trials are managed. And so now we're seeing more online, more distributed, remote opportunities. And so we really felt like we're at a forefront to be able to capitalize, not only to boost our own clinical research leadership, but also to transition into a point of leadership for other rural communities. And so as this work continues, as I said, we're in the thick of the knowledge mobilization, but we are being able to spread our work quite far. Some of it I'll talk about in the panel discussion, but we are connected now with some national initiatives. And so the Voice of Northern BC is strongly positioned on the national stage, which is excellent. So, thank you.
Thank you so much, Davina. Next, we have Lisa Ronald from Simon Fraser University in Northern Health, and she'll be talking about community vulnerability to health impacts of climate change in Northern BC.
Thank you so much for having me here. I realize like maybe I have all our team. I have quite a large team. I apologize, I've just got my name there, but we want to say thank you so much for the seed grant. It really helped us a lot with moving this work forward. Our seed grant we did between 2021 and 2022, but this work is still continuing on today. And the project title, Assessing Community Vulnerability to Health Impacts of Climate Change in Northern BC. And this was an exploratory study that we undertook. So for the context of this project, so we know that Northern BC is experiencing unprecedented climate events. We know this past year with the wildfires, we've seen the rippling effects of 2021, wildfire seasons, record breaking in the past few years. So we know there are these impacts. And we also know that the projections are for these to increase in size and frequency in the future. And so the goal of the seed grant project was an exploratory study to inform future research and also strategic planning for Northern Health for their targeted climate change adaptation. And we had really two foci of this project. And the first was to identify key climate-related hazards and their impacts on human health with a focus on northern communities, and also to evaluate data availability to spatially be able to represent climate change-related exposures in the Northern Health region. And we really, I would say the broader and really a very important component objective of this was for us to expand capacity across Northern Health, PHSA, and UNBC for climate change vulnerability and adaptation assessment in the health system. So we did a number of, as I said, it was exploratory. We had a number of different initiatives within this seed grant work. So we did quite an extensive literature review. We were looking at climate hazards and health system impacts. We also realized to mobilize the health system for climate change adaptation, we needed to really understand the process of vulnerability and adaptation assessments. So we did a review of best practices as well of vulnerability and adaptation assessments. And we did some modeling work with climate projections data to see how it was going to look forward in the future for Northern Health region. So this was just one of our maps. For example, we were looking at what the projections could be going forward and how it might look at community level and also for the health system level. And we also had a student working on an inventory of publicly available community data. So we looked at different websites so it was really publicly available data just to start understanding what different communities were doing with their climate change adaptation plan. So from this work, we did some presentations to Northern Health staff and to leadership, and also we participated in the Northern Health and UNBC Brown Bag Lunch series, where we really were incorporating learnings from the project work. And we also did a summary report, which is now being used by the Northern Health Climate Change Coordinating Committee in their vulnerability and adaptation assessment work. So some of the key lessons from this, again, I say this is really ongoing, but the key lessons from this, we identified that so much of this was really driven from within Northern Health. It was in Northern Health, the research questions were driven by the needs of the health authority. And I think that was really important to address really applied practical questions that the health authority needed. And also being flexible was key when they were changing capacity. So this was coming at the heels of the COVID-19 pandemic, and there was a lot of movement in the system, and the system was so stretched. And so we really found that being flexible to keep the work moving forward was so important. And we had a few core people that were able to keep it going, and now things are just taking off and building. And it's been so helpful to have that piece, this grant, to keep that forward. And next steps, so expanded collaboration between the health authority practitioners and team researchers who are working together to apply for larger funding opportunities. And I'm going to, after, pass the floor to Margot because she's quite involved with that, Margot Parks. And also these learnings and outcomes are being incorporated now to guide the Northern Health vulnerability and adaptation. So thank you so much. And this is our team members. We collaborated with SFU and the ECHO Project Network, and also Northern Health and PHSA. So
fabulous, Lisa. I think one of the reasons that I've so glad to have a team with Sarah co-leading today and with Lisa presenting is that I've actually been out on SAICA's territory in Vanderhoof with the collaboration all day that is related to exactly this project. So Dr. Raymond Fumerton was here earlier, and as one of the medical officers of health who's responsible for the climate and health portfolio and the new team at Northern Health for climate and health. It was the first time since 2012 that we had a medical health officer at a Nechako Watershed Roundtable event, and that event was about drought, fires, and floods. And it was about with a classic multi-stakeholder agency event where the findings from this kind of work and also the nature of the collaboration that the health authority needs to imagine to progress this work in partnership with others. It's a classic scenario where In this work, upstream is a place. They are places, they are watersheds, and they are being impacted by fires, floods, wildfires. And there are other agencies who are needing to champion that work. And part of the role is Northern Health to listen in new ways so that it can be part of those collaborations. So Raina and I, we weren't quite sure if we would make it back in time. We wanted to be sure that we had a great team rep here. But I think the other element here, in the spirit of others, is that these seed grants, they do seed. I think we turned soil, we planted seeds, we watered them, and there's an enormous there's a lot of partnered work that needs to progress in this topic area, as most of these areas. And we're really thankful for the seed grant opportunity and excited about the potentials of this partnership going forward. So thanks again, Lisa. The two other things I wanted to say is that as well as the external facing work, this partnership has fueled internal work at Northern Health, thinking about its climate responsibilities as an agency internally. And then it's also fueling an interesting emerging commitment to intergenerational work, which is another space where public health knows that youth are part of their mandate, but there's a whole imagination space around mental health and wellbeing and climate and engaged land-based work, particularly in benefiting from the wisdoms of First Nations, as we experience today on Sycas territory. So yeah, great, exciting stuff. I'll hand back, Sarah.
Margo, thank you, Lisa. Next, we're going to hear from Emma Rosnagel, who is a research manager at UNBC with Dr. Shannon. And she'll be talking today about a resident-focused gardening program in a long-term care facility growing.
Hi, everyone. I'm going to stand behind the podium to, mix it up a little. But thank you so much for having me, and thank you for the wonderful welcomes that were done at the beginning of this session. So we can move forward right away. So to start off, I'm going to talk about the community-focused, aspect-driven work that the SEED grant allowed us to do. So in 2018, a long-term care facility resident had reached out to my PI, Shannon Freeman, and they told her about the social isolation they had experienced when transitioning into long-term care. They had a huge desire to connect with nature again and be able to participate in gardening. When transitioning to the long-term care home, that connection to nature, having lived all of their life on a rural property, gardening, being with the land, they didn't have that opportunity anymore. So that disconnected feeling kind of seeded the project, and the hope, the aim was to improve mental health and well-being for those living in long-term care. They showed the community collaboration, sorry. So the second point there. So we did some initial research and talked with the long-term care community. What they were telling us is that gardening programs didn't really exist within their long-term care facility. And at that time, opportunities to spend time outdoors were quite limited during long, harsh winters. So a gardening club was formed and collaborated with the rest of the long-term care. And they found that limited gardening programming had been available previously and nothing in Canadian facilities. So our team, including the UNBC lead, Dr. Shannon Freeman, the PHSA lead, Lindsay Vandermeer, and the Northern Health lead, Aaron Bronco, came together and created a gardening program along with the community of long-term care residents. And so that's where we come to the SEED grant program. That partnership allowed us to move forward and create a co-design a long-term care gardening program, which included raised beds outside as well as an indoor hydroponic gardening tower. So now, thank you. The research to impact. So the program was launched. The gardening program was piloted and including many gardening activities. There were also different kind of recreation activities that kind of connected to. So there was smoothie making and tea parties. This was led with by the long-term care facility dietitian Erin in partnership with recreation staff, as well as they planted a variety of vegetables, herbs, and flowers, and had gardening parties, which were wonderful to attend. So that research part came along during the pilot, where there were focus groups, interviews, and surveys to find out how people felt about the gardening program. This was all very exciting because it actually led to a policy change within Northern Health. So this research project was able to generate evidence to allow residents to grow their own food and actually eat it at dinner time, which is wonderful because previously we could only have it during rec time and they could only have it, at 4 o'clock in the afternoon. So this has been a huge impact, which is quite wonderful. Thank you. And that's where we get to now, the growth stage. So these hydroponic towers and gardens were implemented across Northern Health and actually now into interior BC. So right now we're doing a pilot study to quantify staff time, resources, and efforts to safely maintain a hydroponic garden. This was something that was found in the first pilot, that the staff, the champions, are what keeps it going. So we need to look at how we can make this as sustainable as possible. And then the last one here is examine the benefits of hydroponic gardening to support children experience grief. So we're partnered with the Prince George Hospice, and we're going to be doing sessions with young children in grief support groups to see how planting can impact their day-to-day and bereavement process. I have a ton of logos here, but of course we want to thank Northern Health, PHSA, as well as Just Vertical for providing all of the gardening walls, hydroponic towers, UNBC, Interior Health, because we're moving forward with them, as well as CTAN, who is kind of the backbone of doing all the research pieces. Thank you. Thank you so much. Thank you.
Okay, and finally, I'd like to introduce the team to the podium. We have Carolyn Sanders, who's an associate professor at UNBC, and Erica Koopmans, who is the regional coordinator for Northern Health and Child Health BC from the PHSA. Okay, come on up. And they're going to be talking to us about a community participation study exploring the pandemic's impact on the early years across Northern.
We're going to do this on the fly and change things up and try go really quickly because we know we are short on time. So before we quickly dive in, we also want to acknowledge our Northern Health partner as well, Lauren Irving, who's a nurse practitioner with Central Interior Native Health, who couldn't be here today, as well as the other members of our research team, and of course, the families who are a part of this work and our community partners. Next slide. So quickly, this really started out with a phase 1 study, and then the seed grant really helped us continue and grow this work in the north. And that's when I became involved, but I will quickly speak to phase 1. So that started out with 10 parents of at least one child age 0 to 5, really having a semi-structured entry and exit interviews with them. And it was focused on their experience of COVID-19 and the impact on their family's day-to-day life. So what was their experience of engagement with provider services during this time, but also just the general activities with their young children. So it started as a 6-week asynchronous data collection period. So they had their entry interview, and then they were given art supplies, a tablet, journaling materials, however they wanted to document their day-to-day activities. They had that option to do so in an art-based method. And then at the end of it, 6 weeks, having an exit interview. Caroline's going to need to come talk about the analysis piece because I wasn't involved quite yet. So if there's any questions about that, she's the go-to for this. but next slide, please. Yeah. Really the analysis was based on Todorov's model. So really starting with a state of equilibrium, things are normal. We have COVID, it interrupts everybody's lives. It's a major disruption. But then the recognition that this disorder has occurred, how do we recalibrate? What does equilibrium look like? How does our day-to-day change? And it really was a helpful model to analyze these results. So 3 key themes emerged, not surprising to anyone in this room, I'm sure, but gaps in health services, gaps in early childhood education programs, and then those changes to and lost social interactions. Next slide. And really, we found that these families wanted to continue sharing their story. So 70% of those participants wanted to continue being able to document what this looks like through the pandemic period. So that's what the SEED grant allowed us to do. That's when I became involved, and Lauren really were able to expand this work and include more communities outside of Prince George. So the 70% of those participants continued to participate for a 6-month follow-up period. But then we were also able to expand it to engage new participants. So doing that same 6 to 8 week data collection with them across these wider communities, but also including families that have more diverse support needs for their children, and seeing what those service gaps looked like for them. And ended with a lot of interviews and a lot of data from all of these arts-based methods that we're now continuing to work through. Next slide. And so I'm not going to go into too much depth here, but just a few different things that kind of emerged along with those 3 key themes from earlier. In that phase 2, we did see vaccinations becoming a part of the conversation, and what did that look like for family as they returned to social spaces. The discourse around vaccinations impacting some of those social relationships, and a lot of media fatigue and wanting to withdraw from COVID-19 linked messaging, but other public health messaging as well. But recognizing, it's a small group of families, but this was, of concern for them. And that throughout this, parents, because of these gaps in services, needed to be even stronger advocates for their children. And then, mental health tools, and then parental worries about their child's social and emotional well-being because of the lack of engagement in those programs. Last slide. And so one of the things we wanted to do through this arts-based methods was create a keepsake for family, knowing that COVID-19 was a difficult experience for them to go to. It did impact their day-to-day, but there were really positive things that came out of it as well. And they collected those in their journals, through the photos they took on their tablets, through poems that they wrote. And so we were able to create a memory book that then each family received a copy of, that documented the findings of this, but also highlighted it and through the arts-based approach. And I think that's it. We do want to talk more about how it created new partnerships, but I think we'll leave that for the panel.
Thank you so much. That's such an incredible breadth of topics there, projects that were occurring across the region, across the lifespan, and across the disciplines within health research. Thank you all of you for presenting. Thank you. We are running a little bit short on time. I was really pleased to see that the presenters did include in their presentations how the projects are continuing, which is one of our areas that we were going to ask as part of the panel. So thank you for including that. So Julia, maybe I'll hand over to you. Oh yes, you take the piece of paper. And perhaps you could ask maybe 1 or 2 questions, and then just see, we'll just, may not be able to get to all of the questions and all of the teams, but we'll have a couple of questions. Okay, thank you.
Yeah, so we have 3 questions that we wanted to pose to you. Again, we won't have time for each of you to answer all 3. And we also wanted to have a little bit of time if there's questions, burning questions from the audience. You can also reach out after this session today as well if there's other things you want to follow up on. But the 3 questions that I'll just pose to you right now, and feel free to choose whichever one makes the most sense for you. How has this funding or your grant contributed to research or researcher capacity? How has it helped you advance knowledge in your field or extend practice in the field? And how has it facilitated the development of partnerships or linkages across the province? Well, maybe we'll just go one at a time. And if you have something that you want to share about any of those, feel free to connect. We don't have to start here. If you want, we can start at the other end. Or sure, we'll start here. Okay.
Go first. Okay. I don't think I'm.
Oh, okay. Okay, so I'm going to include a couple of pieces really, is to say that child research during COVID in the early years was a great big fat zero globally. Okay, so now we're on the global footprint of saying that early years was absolutely ignored. And our 0 to 8, we have a great way of us having conversations about it and saying, aren't children our future? Sadly, we have a very poor way as a society in demonstrating that. So one of the things that's been really great for us is we made lots of new connections, and some of them are global with our friends and our partners in Australia. And why I went to look at Margot, I have no idea, because that's New Zealand. But so that's an emerging piece of work to work with that population. And with regards to Canada, one of the best things that we did was we got to meet with a new team down at UVic. And the work that we did as part of the SEED grant helped us generate questions that went into a Canadian-wide survey, so that we managed to get the early years conversations out across the whole country. And we worked with the UK, a part of that partnership as well. So it remains that actually we value our children, but we fail to still invest in them in many different ways. So our clinical partners were the people that drove this very much from what they were seeing in practice and what they were hearing from families who were in considerable distress. And what we're now hearing, because we have a SEED network that we work with health, education, non-for-profit, and the Ministry of Children and Families. And so we work across the whole of the North. As part of that network, what we're actually hearing is sadly the fruitions that are coming for the early years is now we have many children in our early years centres who are unable to do the things that we actually discovered and were parents were worried about. So we've lost communication skills, our social and emotional scores are decreasing. We see this from the Human Early Learning Partnership work. So we're going to have a huge point of recovery in relation to early years. And to be really wonderful is the SEED grant was part of us getting on their global network in relation to raising this issue.
I was just gonna say the only quick thing I would add to that, yeah, because there's another important partnership that's come from it within the province that I would say this partnership through this is the Child Health BC chairs the BC Healthy Child Development Alliance, and that's really a provincial version of our northern network, this coalition across sectors. And bringing that work there, we met some people from the Richer Social Pediatrics program, and we ended up putting in a CIHR grant, which unfortunately wasn't successful, but then we got a Vancouver Foundation grant. So really so the gaps in earlier services, it was our data that really helped inform that work, and now we're working on a framework for equitable access to early childhood care and education.
So yeah, I will probably answer a couple of questions in this, but the SEED grant actually really allowed us to make a meaningful difference in the lives of people living in Northern BC, especially those in long-term care. Persons in long-term care are often not included in research, and there can be so many barriers to access, especially in the North, where there's a lot of other things going on in terms of healthcare services. And being able to make that impact, be able to have residents get their hands dirty and garden has been really wonderful for our team. The SEED grant also has allowed us to not only do knowledge dissemination with this project, but the number of people that have been involved, all of which, of course, from the bottom of, I'm sure, Shannon's heart and myself, we thank to be a part of this project. But trainees, undergraduates, high school students, collaborators from across the province and actually across Canada have come in and have been able to take part in this. And that's a really wonderful thing to see, that bringing together of people.
Examples, that's awesome. Anyone over here want to go next? We don't have to go in order, so no pressure if you want to. Okay.
Thanks, Julia. When you were asking those questions, the first word that actually resonated with me was exactly that: partnerships. And in our case, partnerships have not been established within the academic field or within the research field. It had been established with our Northern Health staff members, with the clinical staff members, with those who are holding the hands of patients and clients when they are going through their most vulnerable moments. And what we are seeing through this program, which is ongoing, still, I mean, we have deployed the program for 3 months now, still ongoing. What we have seen is that these staff members, our research participants, they're saying thank you, because we are feeling now, we are understanding now that we matter for the health authority, that there is hope that this crisis can be solved if we all work together, that there are people out there who are interested in what is happening here at bedside. So this is, for me, the most important partnership that we have been able to establish. And once again, this was thanks to this seed grant, which is that, planting those seeds.
Yeah, and I think quickly I'll mirror too. And I think the focus around co-production is such at the heart of this funding competition. And I think it's that's really the magic ingredient, if you like. It's bringing together people that are affected by issues, but also people who are in a position to bring about change. And I think having that philosophy or at the heart of it is really what's making these projects so impactful. I think for us, it was just such a great, untimely opportunity, I think, to really address a strategic and important issue in real time. Like, the funding was available there, and it was just perfect timing. But also, I think it provided an opportunity for us to focus on action and change here in our community. So really being forward facing, trying to be as practical and pragmatic as we can, but also aspirational. Is like, where do we want to see ourselves? Is creating spaces for us to dream big together. And I think that's really important. And a lot of partnerships have been created through the work, but also I think on a national level for us, this work has actually been able to build bridges. And so the CanTrain network, the Accelerated Clinical Trials Network, and the Canadian Heart Function Alliance are 3 networks that really this work now is really impacting. And so that's really $200 million of research funding combined. And there is a real national kind of need to address clinical research in a way that's inclusive, and particularly addresses equity-seeking populations, of which rural and northern populations are. And so I think the opportunity for us to start in our own gardens, our own community, but also to be present on a national stage, I think is amazing. And it's through this competition. And so it's just such a privilege to be part of this work.
Yeah, I think I would really say for us, the building capacity and building networks and expanding networks was such a big part of this. So I think we had a regular meeting that we had as part of this, where we had researchers from different universities come to the table. We had the health authority practitioners, and we were able to really understand what the researchers could understand what the health authority questions were. And I think and for the health authority as well, to learn from that, the research, going about the research process, how they can inform the questions, as well, just actually the practice. So having evidence-informed practice, bringing that in for building the climate change portfolio. So the seed grant work has really driven some of the decisions that have been made about developing the program at Northern Health now, and the work going forward. And we also reached out to partners through the seed grant, federally at Health Canada. We reached out to partners in the Ministry of Health. And so we really expanded on new networks that hadn't, or at least in that format, hadn't been in place. And also it helped to pivot existing relationships and expand. So I think with Margot Parks's work with the ECHO network, and that was sort of became part of it as well. And so, yeah, it was very much about relationships and networks and building capacity.
Thanks, everyone. Those were really inspiring ideas that came forward. I think at this point, we wanted to open it up for some questions from the audience, but in the interest of time, I'm wondering if we should just maybe move to the closing at this point. Fraser, if you're okay coming down. But
so I'll use that. I'm sort of like Esther. I like to walk around while I talk, but I'm not nearly as eloquent. So, but I have the opportunity, or I'm pleased to have the opportunity to thank everybody to do the wrap up here tonight. or today. And so I really do want to thank everybody who's been involved in this presentation, particularly the speakers. Thank you so much for your presentations. Wonderful job. And I'm thanking you for the presentations, but I'm also thanking you for the research that the presentations reflect. I think there's great work that's been done. And I also want to thank you for being bold. I think this grant was really calling for different kinds of relationships, partnerships, different kinds of foci to be brought forward. And you all took a bold step to take this on. And I think it's been incredibly successful. Somebody said the word excited. I'm also excited about this work. I've been excited about it since the inception, which goodness gracious, 10 years. But it's been terrific work. And, you know, you see the success, I think, in the comments that we've had here. I heard about successful relationships, lots of great networks. I heard about the research being published or knowledge mobilization, great work there. I heard about the work is still going on, so it's continuing. I heard about policy, new policy. We've influenced policy, which is great too. And at least once the word national level got used. So I think it's really been a fruitful partnership between the PHSA, Northern Health, and UNBC, and I think this proves it. It has been fruitful. It has been successful, I think. And I do want to mention to people that all the partners who have been involved in this agree, and we have agreed that there will be a phase 2 to this work. So it won't stop here. It'll continue. And I think that's really great. And maybe we've got another 10 years of success coming. Just what's in the works, we're now just talking about, well, what will that phase 2 look like? We don't want to automatically just kind of duplicate what we've done. Probably a seed grant kind of a thing will continue to make a lot of sense. There's been discussion about, is there an opportunity to encourage maybe a bit of a larger initiative or project or fund with a little bit more resourcing, see where that can get us. And the other thing I just wanted to mention is this has caught the attention not only of Ellen Chesney and oh good heavens, Don MacArthur from PHSA, but now Maureen O'Donnell, Dr. Maureen O'Donnell, who's the Executive Vice President of Clinical Services with PHSA, is also very excited about this. And I think that's really neat because a lot of you talked about networking. Well, this is, again, another expansion of the network. Maureen is also involved not only in clinical services with the Provincial Health Service Authority, but also with the Ministry of Health and promoting innovation across the province. And so really interested to get her perspective on how we can build from this incredible work and continue to take steps forward. So more to come. I don't have an announcement of exactly what the substance will be, but I'm really pleased to be able to say that it will be moving into a phase 2. So thank you so much, everybody, for coming, and have a great evening.
Yeah, we're really excited about the fact, I'm just going to turn this off, that there'll be a phase 2. So the HRI will be communicating that with their members broadly, we hope in the new year, early in the new year. So yeah, stay tuned for that. But we've just been so appreciative to all of the partners for their for their past and ongoing contributions to this project. And then I just really want to thank the speakers as well. It was an amazing amount of work that's been done with, you know, these seed grants really that were seeds, but you've really made the most of these grants and partnerships. And it's really amazing to see these projects continuing and continuing to grow. So thank you so much. And thank you to all of you, both here in the room and online, for joining today to help us celebrate phase 1 of our partnership. And yeah, we just look forward to engaging with all of you in the future in phase 2. Thank you.